A very good afternoon to all of you. Thank you very much for joining. We will be starting the session in less than 5 minutes. Very good afternoon and good morning to all of you. And on behalf of NSEFI, I'm very happy to welcome you all for this session dedicated to solar and health. We are very happy to have an esteemed panel of experienced people in the solar and health industry who have spent their professional career dedicated to the intersection of solar and health. And we are at a very interesting juncture, I must say, when it comes to the way energy requirements are spoken about for healthcare, for vaccination, and among other things, there are many countries where vaccination is at its peak, including India. And when we talk about developing countries, the storage facility for vaccines also is directly or indirectly linked with uh, the link. Yes. So with this, I would like to first of all welcome our esteemed uh, panel of speakers whom I'll be introducing in a short while. But before we begin, we have with us Shri Deepak Gupta, IAS retired, presently Honorary Director General of National Solar Energy Federation of India. He was the former chairperson of UPSC and former secretary of Ministry of New and Renewable Energy Government of India, and also former special secretary in Ministry of Health, Family and Welfare. So we are very happy to have Shri Deepak Gupta ji here. I would like to request Shri Deepak Gupta ji to deliver introductory remarks and set the context. Sir, over to you.
Thank you very much and welcome, friends. Solar is going through so much, and so it's good to look at some new areas and maybe tone down the pitch of the arguments a little bit. So I'm glad that the Federation, along with your esteemed members in the panel, has chosen this subject. Of course, in the larger context for the future, solar energy will be determining much of what the environment gives to us, and much of what the environment gives to us will determine how our health parameters will be. But maybe I'll just share some thoughts on the micro potential of solar vis-a-vis health institutions. And of course, most of it must relate to rural health institutions. You must have noticed that over the years, there has been some neglect in the health sub-centers and the Anganwadi centers, which are absolutely crucial for issues like immunization and for the children's health and eventually of pregnant mothers. And I believe this is one of the most important problems India is facing, along with nutrition. Most of these buildings are in a state of neglect. In this budget, we have announced setting up thousands of wellness centers, which is really a priority area. But most of these buildings, I think maybe more than 75%, they do not have electricity or running water. And solar can provide both. And it will be a sea change in how these centers attract people, having electricity and having running water through maybe a solar pump or the pump which takes the water up to the tank, and which will allow a functional toilet. These are very small things, but these small things will mean a huge amount. We don't, sitting in our urban areas, think of the problems. So I think this is the biggest potential, and if we were to have some policy, maybe one priority would be to 100% cover such centers and Anganwadi buildings with solar power for both electricity and drinking water. Then we come to the higher levels and we come to the PHCs, and probably I'm told the statistics say 5%, but once again, statistics normally hide things more. So there are a huge number of PHCs, especially in remoter areas and in eastern India and the northeast, which don't have electricity and moreover don't have reliable supply of electricity. So the second priority would be, if we are able to identify such PHCs, that to solarize them, and also with some degree of storage, so that power is available. And once again, I would think of other things like water and pump and all that kind of thing. By the way, in the solar mission time, for J&K especially, because of the interest taken, and my minister was from J&K at that time, we had a special program for PHCs and rural centers for solar. I don't know, I was told at that time it is doing well, and it would be worthwhile to study whether it actually worked and what kind of benefits it gave or not. And certainly I personally saw that this was done for Ladakh area. So it would be useful to know what happened. There was another problem, partly related to health, but it's a kind of an integrated thing. And I am talking of girls' schools in the country, in the rural areas. A study has just come out which shows how many of them do not have either running water or functional toilets. Now, for girls' education, this is crucial and critical. Once again, if solar provides this kind of facility, and I saw in Chhattisgarh, even in those years, that there were schools, I'd visited some schools where the pump was being run, solar pump was providing water up to the top and it was coming down. And these middle schools with electricity and water and functional toilets will do a lot, not only for education, but also if we look in an integrated way for the health of the girl child. So these are three areas in rural areas which are immediately possible to be done. I have visited many forward areas of our army and paramilitary forces right across the northern border and from the west to the east, including Sikkim, northeast, Nagaland, and Ladakh, etc., and the Uttarakhand region. And all these posts can be solarized, both for hot water, for cooking, etc., and electricity. It will create a huge amount of facility to take away the kerosene, etc., from these places, so that it is of great benefit. And for one area which we now have to examine and technologically perhaps see, whether we can re-establish some possibility of solar cooking either through the dish or through the old solar cooker. Can we, now that solar prices and costs have come down, technology has gone up and become much better, is there a possibility that along with the gas chula, we are somehow able to add some kind of solar cooking facility? So together, we will probably do away with the biomass stove if we can do that. And finally, of course, the potential for future healthcare is going to come from new kind of diagnostics, which can be used in very simple settings by even people like Ashas. And if you are able to use these instruments and then have a OPD, which is through the telemedicine framework, this will be a revolution in healthcare. So if such kind of things of the diagnostics, if they can be powered where there is difficulty through solar, then the possibility and potential is absolutely immense. And of course, I don't have to mention that the cold chain for vaccination, etc., requires electricity all the time, and solar with battery could then fill up the gap. So in a way, you can see it's one of my guiding principles of what I think and what I try to do in my career was to look after small things which people don't pay attention to. Now we are all very excited about 1,000 megawatt solar plant. What wonderful things it will do for this country. But 1,000 megawatts in the health sector can change the face of rural health in India, and how important that is. So I hope that you will kickstart this process of focusing on the small but important things which matter to millions of people in this country, and start a dialogue with all concerned of how you can put this kind of policy and implement it. So with these thoughts, some of them may appear unrealistic, but rather than dream of, if you are an Indian today, you must realize our nutrition status and our rural health status, which is a matter of shame. And we can do something, and if solar can do something positive in that, nothing could be better. So I hope this initiative of yours will result in something positive and worthwhile, and I wish you the best, and I think you should seriously work towards it. Now that solar rooftop is going to have difficulties with its 10 kilowatt system, maybe the 10 kilowatt will allow you to put solar on the rooftops of all these institutions in the country. And let us find a policy to do it. And maybe you can find some CSR also if it can help you to do it in selected areas. So thank you very much, and I wish you all the best. And I hope you will come out with some kind of a roadmap and the next steps to be taken. Thank you.
Thank you. Thank you very much, sir. As always, you have given us a lot of food for thought, and not only setting the context well for today's discussion, but you have emphasized the three main areas that require our immediate and acute attention. And we are very happy, and I hope that today's panel discussion will be steered, and today's presentations will also give us an overview of what is currently happening on the ground. So without much delay, I would like to introduce today's stellar panel. I would request our panelists to kindly switch on their cameras as I announce their name. At the outset, I would like to invite Dr. Purnima Prabhakaran, who is additional professor, head of Environment Health, and Deputy Director at Center for Environmental Health. Thank you very much, Dr. Purnima, for joining our session today. Dr. Purnima is a trained physician in Bangalore Medical College, and she has a master's in epidemiology from London School of Hygiene and Tropical Medicine, and a PhD in social medicine from the University of Bristol, United Kingdom. Her doctoral work in Andhra Pradesh Children and Parent Study brought to focus the importance of life course approach in the prevention and management of lifestyle and metabolic disorders. Since 2015, Dr. Purnima moved her focus to the study of environmental health, risk factors, and is currently additional professor, head environment health, and deputy director at the center deputy director at the Center for Environment Health at the Public Health Foundation of India, where she leads a team of nearly 20 researchers and consultants on research, training, advocacy, and capacity building for environment health issues spanning all, including air pollution, climate change, water sanitation, chemical and heavy metal exposures, and children's environmental health. Thank you very much, Dr. Purnima, for joining us today. We also have Mr. Rajiv Gyani, who is Additional Director RE in International Solar Alliance, also a very good friend to National Solar Energy Federation of India. Mr. Gyani, he is working in the field of renewable energy conservation since last 32 years, and he started his career in Madhya Pradesh Urja Vikas Nigam in 1988, and after that he worked in Chhattisgarh Renewable Energy Development Agency, and he was also in charge of various projects of solar photovoltaic and other renewable energy projects. He was also the regional head of Raipur and Rajnagod region and project head of many energy conservation programs. He has also written various papers. He's also a certified energy auditor, and he's in his new role as additional director and national focal point coordinator and in charge of ISA program. He is working on scaling solar applications for agriculture uses, and he also coordinated the world's largest unique price discovery international competitive bid for around 270,000 solar pumps for ISA member countries. Thank you very much, Mr. Gyani, for being with us today. We also have with us another active member of NSEFI and the chair of our Rooftop committee, Ms. Ritu Lal. For people in the solar industry, she doesn't need any introduction, but she is currently the senior vice president and head of institutional relations at Amplus Solar. Amplus, as we know, is one of the largest distributed solar companies in India, and they have grown leaps and bounds. She is responsible for, she is a keen advocate of policy support, and she is responsible for initiatives that are aimed at increasing India's adoption for solar. Her career has been marked with diverse geographical exposure along with India. She has also worked in Europe, Asia Pacific, Middle East, and Africa. She has been with Amplus from its early days and previously was the head of business development. And she has a rich experience of over 20 years across various fields. And in addition to her business roles, she is also very actively mentoring young solar professionals across the country. She is a very familiar face in many industry sessions, in many industry academia training programs. And she is also one of the most welcomed industry expert in the think tanks that are currently in India today. Thank you very much, Ms. Ritu, for joining the session today. We also have with us Dr. Payal Parekh. She is from Power for All. Dr. Payal Parekh has doctorate in chemical oceanography. She is currently the global director for health at Power for All. She has a doctorate from Massachusetts Institute of Technology, MIT. After working with climate models during her postdoctoral research at University of Bern, Switzerland, she returned to her passion of social change, focusing on anti-poverty and environment justice campaigns, working for international NGOs, including International Rivers, Greenpeace, and 350. Currently, she works at Power for All, leading the organization's work on powering healthcare centers with decentralized renewable energy. Thank you very much, Dr. Payal Parekh, for joining this session. And last but not the least, we also have Mr. Dheeraj Kumar Gupta, project associate from WRI India, based in Ranchi. He supports the work in Jharkhand to improve access to reliable, affordable, and sustainable energy for all. He engages with government and non-governmental stakeholders in rural areas to find solutions and expertise for access to clean energy, along with meaningful interventions for development. Prior to joining WRI, he worked with Aga Khan Rural Support Program and before that he was a solar project engineer. He holds MTech from Central University of Jharkhand, Ranchi. Thank you very much, Mr. Dheeraj, for joining this session. So without much delay now, since we have introduced the fellow panelists, I would like to start the discussion right away. For the sake of our audience, uh, today we have the panel discussion will be sort of a combination of presentations and panel discussions, because we have scientists, we have industry stakeholders, we have international organizations who are in the call with us today. So based on their expertise, they'll be either sharing presentations or outlining their views. With this, I would like to ask Dr. Purnima Prabhakaran from the Center for Environmental Health to present her findings and insights on solar for health.
Thank you, Mr. Pulipaka and NSEFI for this opportunity to be part of this forum this afternoon. Good afternoon, everyone. So as introduced by Mr. Pulipaka, I represent the Public Health Foundation of India's Center for Environmental Health, and I'm also a senior research scientist at the Center for Chronic Disease Control. As the initial speakers have already elucidated, India has made massive strides in the solar domain. And it's really heartening to note now that the industry is now turning to look at the health sector. So over the next few minutes, I will walk you through the perspectives of the whole topic from a health lens. So talking about solar for health, is there a case for solar is how I would like to start my talk this afternoon. And really, looking at it from a health lens, we have all known living in Delhi and in the nearby regions that air pollution is a big health issue. And fossil fuel generated electricity, on which India is now still very wholly reliant on. About 70% of our electricity comes from coal-fired thermal power plants. And this has been documented as a big source of air pollution in our country. And therefore, it's one of the biggest reasons why we think that transition to new and renewable forms of energy is critical for all sectors. What about the health sector? Is solar for healthcare a case to be made? Will it be a boon or will it be a bane? And intuitively, we think that probably it will be beneficial, but I'd like to make the argument for that through a couple of perspectives. One is that efficient, continuous energy supply is key for effective healthcare operations. And that goes without saying. If a healthcare facility has to function efficiently, we do need continuous energy supply. Paradoxically, the other argument that I'm going to place before you today comes from a climate perspective. And you might be surprised to note that the healthcare sector has its own emissions. And mitigation is critical to ensure that we lower our climate and energy footprint. So the healthcare sector, which is supposed to provide care, can paradoxically also cause harm if we do not address this perspective as well. So these are the two arguments that I would make for solar for health. One, that we do need continuous energy supply, and two, that we have our own emissions to take care of. And just to bring us all on the same page, I recognize that the audience may not be entirely familiar with the Indian healthcare sector. This is just a graphic to show you the scale of the Indian healthcare system. It includes multiple systems of medicine, mixed ownership patterns, and different kinds of delivery structures. And the challenges are due to the scale, the diversity, as well as the governance of the sector. So on the one side, I will start from this side. You're familiar with the private healthcare system, where you have multi-specialty hospitals down to nursing homes, private clinics, and charitable trust dispensaries. But we also have some of our ministries, like the Ministry of Railways has its own hospitals and dispensaries. The Ministry of Defense has its own base hospitals, specialty hospitals. We are familiar with the Army Medical College hospitals. But there is this whole public healthcare system under the Ministry of Health and Family Welfare, which includes tertiary care centers and hospitals like the All India Institute of Medical Sciences, the medical colleges and their attached hospitals, CGHS and their dispensaries, down to the very lower levels of our healthcare. At the state level, you have the district hospitals, the community health centers, primary health centers, which Mr. Deepak Gupta mentioned in his opening remarks, and then the sub-center, which is really the lowest level of the healthcare system in India. And this is the level that will now be transformed into the health and wellness centers under the government's Ayushman Bharat program. And at the very, very periphery, we have the frontline healthcare workers, the ASHAs and the Anganwadi centers at the village level. In India, for people who are familiar, health is a state subject. So even at the state levels, we have state hospitals, municipal corporation dispensaries, ESI hospitals, and then the Ayush dispensaries and hospitals. So when we're talking about bringing some kind of transformation in the Indian health sector, this is what we have on our platter. We have a huge healthcare system with multiple ownership patterns and very, very different governance structures. So what is the nexus between energy and health? Energy is required in the healthcare sector for basic healthcare delivery, for inpatient, outpatient services, for resource utilization, whether it is for electrification of the centers, for using water, this was also mentioned by Mr. Gupta in his opening remarks, for lighting, for heating, for cooling, for all the ancillary services, whether that is laboratory services, the use of the medical equipment within the facilities, but also for basic operational care, whether that is labor room services, neonatal care, operation theaters, the immunization services, which also got mentioned already, and we have it has become a stark fact now in the current pandemic, the need for a good cold chain supply maintenance, and energy plays a big role over there as well. I've also listed staff retention, the reason being a good functioning healthcare facility that has good energy supply is also important in terms of retaining staff. If there is a non-functioning, poor infrastructure healthcare facility, it is very difficult to retain staff as well. Therefore, uninterrupted power supply is so critical to efficient functioning and better healthcare delivery. So there is really, this is pretty intuitive and straightforward, but it's good to remind ourselves. The next couple of slides, I was just going to take you through some work that was done by the Council for Energy, Environment and Water. This was an analysis they did from the district level health survey of a few years ago. But I think the statistics still hold good. And what they found was access to regular electricity supply in our primary healthcare centers might have improved slightly in the study period from 2007 to 2013, but only half of all those PHCs had regular power supply. So there's a difference between access and what actually happens on the ground. So the power supply might have been installed, but it may not be irregular. It is often interrupted supply. And there's a lot of variation between states. There's a lot of variation within states, ranging from 93% in Kerala to about 8% in Manipur. This was about 5 years ago, but I'm not sure that much has changed since then. And in about 11 of those 29 states, electricity access was below the national average that was envisaged to electrify at least 50% of PHCs across the state. Now, even within PHCs that had the energy access, not all of them were able to deliver completely efficient healthcare delivery operations. And this is a graphic that shows the service provision by electrification status of the PHCs. So the blue bars are PHCs with no electricity connection. The orange ones are with irregular electricity supply. And the green bars are the ones with the regular electricity supply. And clearly across the board, whatever indicator we are looking at, whether it is 24/7 services, laboratory services, delivery services, which is labor room services, and delivery services conducted when a labor room is available. Oftentimes, there's not even a labor room available in some of these peripheral health centers. So clearly, the ones that have a regular energy supply are the ones that do better. There continue to be some challenges though. Despite having energy supply, power cuts happening in peak hours, in the evenings and nights, often unavailable or interrupted emergency care occurs because of these interruptions. And often people turn away from these primary healthcare centers and the community healthcare centers. Despite having economic constraints, there's a decreased footfall and they don't resist from spending out-of-pocket expenditure for private healthcare, and which increases the family's healthcare costs. We already mentioned cold chain supplies. There are problems with vaccine wastage if we don't have efficient energy. Last mile healthcare delivery continues to be a problem for India, which is a vast country with lots of people living in the rural tracts of the country. Last mile healthcare delivery still is a big problem in the country. And we are advancing towards the concept of universal health coverage, and energy is a big core requirement in all of those aspirations. So this is a map of India which shows the PHCs across the country in terms of the state of electrification. And what we know now is that more than 60% of the rural population in India is dependent on the public healthcare system. About 5% of our PHCs do not have access to electricity. And the most recent factor, I think Power for All panelist is here. And recently there was an initiative that was led by them. And they had this finding that about 40,000 sub-centers in the country, which are really the lowest level of healthcare at the front line, serving 230 million people, do not have access to regular energy. Again, 1 in 2 PHCs have no power supply or have irregular power supply. So really there is a case to make for decentralized energy in our healthcare systems. And solar for health, is there a case for it? The obvious answer is yes. And we do have examples, and the exemplar that we always use is the state of Chhattisgarh. And this is a case study again from that state, where the Chhattisgarh Renewable Energy Development Agency was commissioned to take forward solarization of their PHCs. And back in 2012, I think it was about 600 PHCs, but I know it's way more now. And most of the PHCs in the state of Chhattisgarh have been solarized. So this is a picture from that state, and with their solar backup, they're able to have at least 4 hours of backup. And again, an evaluation study from CEW had shown that 70% of health facilities with solar were able to provide 24/7 services compared to 48% in those that did not have the solar backup. And pick any indicator. This is the outpatients treated per PHC per month. Those with solar were able to see about 630, whereas those without solar had 480. Similar statistics for the inpatient load as well. So solarization of the PHCs did have an impact on health indicators and health service outcomes. And this is, again, just perceptions of the healthcare staff. Just talking to the healthcare staff, the proportions of PHCs reporting service improvement due to solar, about 60% admitted and clarified that, yes, there was an improvement in OPD services, there was an improvement in inpatient services, improvement in the number of deliveries that they could attend to, as well as improvement in the laboratory services. And nearly 100% had agreed that solar has helped the day-to-day operations of the staff and doctors in the PHC. Solar provides backup as promised, about 80% agreed. And most importantly, there was cost savings that were experienced. And that is an important criterion for advocacy to transitioning to renewable energy. So that is one perspective and argument for solar for health. The other one that I wanted to bring to the forum today is about the emissions from the healthcare sector. And why is that important? So many of us are familiar with the Paris Agreement in 2015, where the UN had committed to every sector in every country in the world committing to reducing their emissions across sectors. And the World Health Organization, which is the overarching organization for healthcare systems around the world, was not behind. And also at the same time in 2015, the World Health Organization had also started talking about climate resilient health systems. And I won't get into the details of this graphic, but just to say that there are 6 building blocks towards building a resilient health system in any country. And that includes leadership, a good health workforce, health information systems, essential medical products technologies, service delivery, and health financing. And all of this has a nexus to energy requirement in one way or the other, direct or indirect. And I want to bring to the forum here the concept of climate smart healthcare, which came off this conversation of climate resilience within healthcare systems. And the organization called Healthcare Without Harm, which has an international presence, has been at the forefront and worked with the World Bank in 2017 to bring this report out on the concept of climate smart healthcare. And what this really speaks to is a combination of developing health systems around the world, prepping them to adapt to changes in climate change, changes and impacts on the health care, on the disease burden. That is one piece where healthcare systems become more equipped to deal with the disease burden. But there's also the other piece of climate mitigation. And this work that came from Healthcare Without Harm in 2019 talks about decarbonizing healthcare. And what that speaks to is the fact that healthcare systems around the world together contribute about 5% of the global greenhouse gas emissions. And if all the healthcare systems were put together, they would be the 5th highest country in terms of emissions. And to give that in perspective of coal-fired thermal power plants, it will equal emissions from 500 power plants. And that's a very staggering statistic. This I already mentioned, they would, if the healthcare systems around the world were put together, we would be ranked 5th among all countries in terms of our emissions. So that's not a good feeling, healthcare sector causing harm to the environment. And this concept has been taken forward within the concept of climate smart healthcare to encourage health systems around the world to get onto a path of decarbonization. And a big part of that comes from reducing their energy use. This is a graphic that shows the different components of healthcare emissions, and a good 40% is due to the use of energy, the generation and the distribution of electricity. The same report actually gave a perspective into India's own climate footprint, Indian healthcare's climate footprint. And it was envisaged, this is actually an estimation from a modeling exercise. So it said that the climate footprint of the Indian healthcare sector was something in the range of 39 metric tons of carbon dioxide. Again, equivalent to about 10 coal power plants emissions. And a big chunk of that comes from the supply chain energy utilization, but also from the own operations, the healthcare delivery operations and the utilization of energy within healthcare facilities. So there's a big scope for healthcare facilities across the country, both public and private, to think about the way they are using energy. And the report emphasizes that much of the energy comes from fossil fuel. And this is about 2% of the global healthcare emissions, the emissions from the India's climate footprint of the Indian healthcare sector. This is still speculative, and we do not have exact data of the energy consumption in the Indian healthcare sector. And our team is actually setting out to do an energy audit of the Indian healthcare system, which will inform this piece. But really, even though India is apparently electrified, 100% electrified, the last mile connectivity still remains a problem. And because of the fact that I mentioned earlier that efficient energy supply is translating into good healthcare outcomes, and the fact that healthcare systems continue to use very polluting sources of energy, there is a good case for transition to renewable energy. And we are having some examples already documented through case studies that there are some front runners within the Indian healthcare sector, as there are in other parts of the world. So this graphic is actually to show that India is among the top 10 emitters in terms of healthcare emissions in the world. And there are examples from other countries in Europe, in Africa, very innovative ways of utilizing solar for healthcare. This is actually in a really arid region where solar is being used for vaccine carriage and storage. But as I mentioned, we have examples in our own country already, like Chhattisgarh, the primary healthcare centers. This is an example of boat clinics in Assam. So these are boats that travel across the Brahmaputra River delivering healthcare, and they utilize the solar panels for their energy. And we do have documented case studies among our own network of private healthcare hospitals who have already become front runners in transitioning to renewable energy for their operations. I just want to take a step away from the actual ground reality in the healthcare to what happened in the policy space in India. And for those who are hearing this for the first time, there was a Prime Minister's Council on Climate Change that was established in June 2008, and which resulted in a national action plan for climate change for India. And within that action plan, there were 8 missions. And you will note here that there was one for solar. And of importance to note here is that there was no health mission at the start in this climate change action plan. It was only in 2015 that a health mission was also commissioned and resulted in a national program on climate change and human health, which is under the nodal Ministry of Health and Family Welfare. And the nodal agency for this program is the National Center for Disease Control. And this agency has now commissioned reputed scientific expert institutions across the country to help them in different parts of a framework development for action plan for the health sector in India. And the Public Health Foundation of India is a designated center of excellence for implementation framework for climate resilient and green healthcare, which talks to the concept of mitigation of the healthcare sector emissions. And we are working with the Ministry of Health to develop a framework that can be then translated into state action plans for climate change across the country. And this whole concept of climate smart healthcare, which I already mentioned before, while it prepares the healthcare system to deal with the health impacts of climate change, has this important component of decarbonization. And energy is a big, big piece within this conversation. So we have worked already with policymakers. We have presented a plan to the Ministry of Health on the importance of the health sector in dealing with climate change. We have tried including this concept within the Indian Public Health Standards guidelines, and as well as within the private healthcare sector, talking to private healthcare sector players about the need to turn their operations green. And again, a big part of this is the way they use their energy. The private healthcare network that we work with is actually a health and environment leadership platform forum that we have established in collaboration with Healthcare Without Harm. And this is a network of private hospital players across the country. We have brought them together within our network to align thought leadership amongst these healthcare professionals to become aware about environmental issues and advocate for not just green healthcare, but also other environmental issues like air pollution. And the network today has a membership of over 7,000 hospitals across the country. So we are working not just with the government and the Ministry of Health, but to impact the public health system, but also through this network of ours, we are also sensitizing the private healthcare players about the need to make their healthcare facilities green and resilient to climate change. And the framework, I'm just giving a fair peek over here into what our framework will involve. We talk about a site selection in terms of climate vulnerability. We talk about very many different pillars within it, but a big part of our framework is focusing on natural resources, air, water, food, and of course, energy. So the case for solar in health is clearly being made. We're talking to the policymakers and about the different dimensions of green and climate resilient healthcare. And I want to reiterate that this is an ongoing conversation, but what it really requires is intersectoral coordination. So I'm really encouraged to see that the Ministry of Renewable Energy is now taking note of the need in the healthcare sector. There are other ministries also that are looking at energy, and we really need to take away some key messages over here. The transition to solar and other renewable energies is really beneficial from not just a health perspective, but also environment and social perspective. Huge health benefits in the case of efficient, uninterrupted power supply. India's health sector has the 7th highest climate footprint in the world, but in terms of lowest per capita emissions, but still there is no room for complacency, and it's time to act. The health sector is already leading the way, but we really need to talk to the renewable energy sector for ground implementation, and that is key. So that's my message for you today, and I hope it will stir some food for thought. Thank you.
Thank you very much, Dr. Purnima, for your insightful presentation. In fact, I personally had a lot to learn from your presentation today. And I'm very sure we will try to, I can promise you one thing, we'll try to take this message back to the ministry. Today in our panel discussion, we do have stakeholders from the industry. So whatever can be done as an industry response, as specified by our Honorary Director General Deepak Gupta ji, we'll be looking forward to sort of take it forward. Coincidentally, I would request Mr. Rajiv Gyani to speak next, who comes from Chhattisgarh background, and you're taking Chhattisgarh's example, and I am sure he was in CREDA for some time. And now he's with International Solar Alliance. So, Mr. Gyani, why do you think you are at ISA? ISA is a global body now, sort of with a resounding leadership from the Indian side. Where do you see the appropriate approach for solarizing the healthcare centers going in the Indian context, and what will be the benefits for scaling it up? And especially, I'm very much following ISA's events, and ISA also has plans for solarizing the primary healthcare centers in different ISA countries. So can you take us through those plans of ISA also?
Thank you, Subramaniam. I think the presentation of Dr. Purnima has all 365-degree angle of all the aspects possible for the health center, except for one issue, that is operation maintenance. Because installing in a solar plant is the easiest task, but to maintain it is the most difficult part. And as he also pointed about Chhattisgarh, she also pointed about Chhattisgarh, even Dr. Deepak Gupta ji pointed about Chhattisgarh projects. So these projects are working since last more than 10 years. And among this, our participant today, we have Mr. Sanjeev Jain, also who is the chief engineer of this project. And when I was there, the project started with the initiation of the health department. Now, I'll just take more broader view of what you have asked me. Why solarization is important in the health sector? Because all the health sectors are installed already with electricity supply. But as we know, it's not certain, unpredictable, and without electricity, you cannot imagine the operation of health center. So we should have some source which can generate electricity there itself. That is solar photovoltaic. So solar photovoltaic had been accepted universally for the health center, so that the power where you require it is generated there. So why this solar is important? The beauty of solar photovoltaic is that it can generate power from milliwatt to megawatt. So this power can be customized with respect to any demand of any consumer. So here it is health center. So whatever is the requirement of the health center, starting from primary health center to the super specialty health center, the solar photovoltaic can provide electricity or can customize their demand of electricity. Now, one more thing which Dr. Punima's presentation should have included is the reduction in the mortality rate of the newborn child during the which was also one of the study of CEW. Now, what ISA is envisaging in this particular field of health center, ISA has a clear vision of scaling up of the project. Why scaling up? Because by scaling up, the project becomes viable economically, finance become viable, and there are many takeaways, and then the government of that particular country, I'm not talking of India alone, I'm talking of global, all 193 UN member countries who are the prospective member countries of International Solar Alliance, can plan exclusively for their health centers for solarization. Why? Because there are some set norms for every hospital. See, primary health center has some standards, then district hospital has some center, sub norms, community health centers, and so on. So they have specific demand of electricity. So according to that, with respect to different categories of health centers, the program can be prepared in a scaling up manner, demand aggregation. Because our experience in last 3 years in ISA is that, for example, I take of solar pump. See, we have done a demand aggregation for 22 ISA member countries for 2,72,000 solar pumps. Now that has two outcomes. One is that the standards, international standards of solar pumping has been set, and now the price has been discovered, which are about 42% less than the prevailing price in the market. So that has become a benchmarking for the countries to prepare their solar pumping program in the country. Now see, in India, there is no state or town which doesn't have a health center. Now the biggest task for solar system is to retrofit in any of the health centers. So retrofitting is not an easy task. See, everybody knows that it is very important that you should have a solar system on rooftop. So is the rooftop sufficient for solar system? If not, then shall we go for it or not? Is there any spare room for keeping up the batteries and all? If not, then can we install the solar system or not? All these questions are irrelevant. I repeat, irrelevant. Because this system has to customize with respect to the need of the site. So if you have in mind that if the roof is not appropriate, then also solar system can be installed. The design should be accordingly. So according to that, in International Solar Alliance, we have created the ISA Care Initiative. It was launched by the President of ISA Assembly, who is Mr. R.K. Singh, the Honorable Minister for Power and Renewable Energy, New and Renewable Energy. So this ISA Care Initiative has a target to install at least one primary health center in every district of every small island developing states, which is called SEEDs, and also least developed countries. These are the two categories defined by United Nations globally. So as of now, we have 47 SEEDs and LDC countries where we are initiating to support these countries to solarize their health centers, primary health centers. The situation in all these countries are not good. They have some of the power generating system in their country. They have some diesel sets, they have some small solar lighting system also, which are not functional. So how to cater this demand? For that, ISA has created this demand, and we are working exclusively. As of now, we have about 27 countries we have prepared the project, and shortly in coming few months we'll be moving forward for the implementation procedure in these countries. I was fortunate enough to accompany Deepak Gupta ji when he visited Chhattisgarh. So what he was telling about the solarization of the girls' school also, that is one of the aspect in which the solar system is used to lift the water from the ground and fill in the overhead tank. And in that, it was RO system wherein the water wastage was utilized for the toilets of the girls. And through this initiative, the learning from the India, the ISA will naturally become a leading organization which will be supporting countries in enabling them to stand on their own foot so far as the solar health solarization is concerned. I think there are many more things to tell, but the time is less, so I should not take more time and let others panelists to speak. Yes, Mr. Subramanian, over to you.
Sir, thank you very much, sir. In fact, we are very happy that ISA is leading by example by trying to take India's success stories to other countries. And for someone who has been to Africa and who studied extensively the electrification, especially in East Africa, I truly believe that ISA's programs will have a very significant impact, not only on the healthcare system, but also on the electricity access and improving it in the global context. Thank you very much for all your efforts, and I'm sure this will make India a true leader on the global scale when it comes to solar energy.
Yes, thank you.
Thank you. We will now shift our discussion, focus of our discussion to the industry. And I would like to invite Ms. Ritu Lal from Amplus. Ms. Ritu, Amplus has been at the forefront of distributed solar energy proliferation in India, especially catering to the mission critical loads, be it healthcare centers, hospitals, or other companies, other pharmaceuticals, which are very much important to the entire healthcare ecosystem. So what, according to you, should be the direction in which we should go when we talk about solarizing healthcare, and how, as a private sector, you look at this market? And do you see any special incentives or requirements that the government should come forward, or as an advocacy body, we should put forward to ensure this proliferation happens in a very sustainable manner?
Thanks for that, Subbu, and it's been an extremely interesting discussion for me so far. It's always great to get a perspective close up of those aspects of the country which you don't, really get to in your day-to-day activities, that you may have read about out of largely your own interest. But to see the data presented today on public health institutions, especially at in the rural levels, was quite eye-opening. And the very first thought I had was, how far removed Delhi is from the rest of the country. When we look at issues and problems, even when we address solar as a rural phenomenon, we talk about farm solar, right? That there is this the farmer and the field and the solar, and that's where our discussions really end. Whereas the examples that we saw today, these are examples that you can replicate at the urban level also without storage, right? It's very, very simple to execute. Yes, of course, it's a huge market. And I know in India, we keep talking about potential and India's size, and India can be the number one. We don't have to work towards a goal of being number one. We are one of the geographically largest countries in the world. We have among, the second highest population of the world. We're very, very densely populated. It doesn't take anything for us. If we just fulfill what we are doing, we'll be number one, number one in anything because of the size. Number one in solar installations, number one in vaccines, number one in anything, simply because we have that scale, right? And it's not really an achievement or anything that detracts from it. It is what it is. So my first thought would be to focus on what we need and what we want to achieve, and thus devise targets, rather than give ourselves an ambition which is based on a thought or a whim, but not reflective of the need. And sometimes, and I think it's important to do that, because when we start chasing statistics, we miss what we need to do. And I'll give you an example. When we are chasing the goal of 100 gigawatts of solar, There's various ways of achieving it, right? Mathematically speaking, I could do 100 gigawatt scale farms, which again, on the size of this country, is not outlandish, right? And I could get there. But I also need to look at what the needs are. And we have, I do work with you, Subbu, and NSEFI on the Rooftop Committee. So far, we've served the larger customers of electricity, mostly in the private sector. But that's also because those are the ones who pay a huge amount for electricity, and it's given them, apart from green energy, so far the business model has also been focused on giving them savings. Okay. When I look at the needs, can we do this in the same model for public healthcare? Part of it, yes. But for some part of it, I don't think it is going to be only a commercial play. Right? But it need not just be a commercial play. Right? Solar plus storage works very well. The more technology we use in healthcare, at the end of the day, it percolates. Whether you have a hospital or not in a village, the state of your primary healthcare center, whether it's good, whether it's completely lacking, be that as it may, every village has smartphones. Okay? So technology is there and technology is reaching people. And the more reliance we have on technology, the higher will be the need for electricity. Like, when you're going to improve a primary healthcare center, what you're going to put out there, right? Diagnostics. Apart from the human element of the staff, you're going to have diagnostics, you're going to have machinery, you're going to have treatment facilities. The more you get into that, the more dependent you are again on electricity. Right? And like I said, Delhi is so far away. I mean, the thought of giving birth in an environment which is not designed for it, and where there is no electricity, is the reality for so many women in this country. And it's something which is completely it's a terrorizing thought for the rest of us. So we need to obviously look at it differently, whether it's a subsidy, whether it's an incentive. It's a question of affordability, definitely, because we are a country with limited, when I say limited resources, the strain on those resources for various initiatives vying for attention, many of them critical, many of them important. But I'd say, like obviously when you look at life and healthcare, I think it kind of supersedes many, many other of the priorities that we have as a nation. If anything, the pandemic has exposed our infrastructure on healthcare, and how superficial it is. The large skew between the skew between urban health versus rural. And when I'm talking of urban, I'm not just talking of megapolises. I'm talking of cities and towns versus rural India. The access that rural India has, all of that has come up, and I think sooner or later, sometime or the other, I don't know if it's going to happen in the next 5 years or the next 15 or the next 20, it will have to be addressed. The countries to really, really make a progress. Solar plus storage is an excellent idea, right? First of all, even if I look at viability and clean energy, it is cheaper than producing diesel generated electricity, which is what, if you are running a health facility of some quality which needs electricity, I don't think you can afford to have one without a power backup. So if you're using diesel, in any case, as expensive as storage is today, solar plus storage is going to give you a benefit from that, right? These are easy to set up systems. You can do a very good, quick installation, which is of high quality, which will generate employment, right? None of that is an issue. Because you're doing localized setups, again, you are not bothered by creating T&D supplies, right? You will make do within the existing infrastructure. You can look at community solar projects. follow the model that they had in I mean, and I know it was not done to electrify, but rural Japan has a lot of community solar. In India, we have community solar, we have rural solar. It is entirely, I think, the private sector that works in there. I think a lot of them have aid from foreign bodies like the World Bank and other such organizations. But they work completely, when I say off-grid, they work off-grid even from government schemes. And I was told, and I was having a conversation with one of these guys that had about 100 microgrids in rural India, I think most of them in UP, that there is no guarantee that should that particular village where they have like 100 kilowatt plant, and their business model is very simple. They say we find an anchor client. The anchor client typically nowadays tends to be the mobile tower. That becomes your anchor client, and then from there on you build the rest of the supply network. They even have to do a miniature T&D network, which apparently is also not so challenging. The issue is that tomorrow that setup gets grid electricity. There is no guarantee to what happens and how these guys recover their investment. So because if they come in there and if they come into the rural segment or the farm segment, whatever, and if they're getting today electricity at 14, 15, 18 rupees a unit, which is what it comes to actually. If you look at it, they don't really buy electrical units. They pay a monthly sum for like a fan, a light, and a mobile charge point. That's how it works, right? And it's in double digits if you look at the actual cost per unit that they're paying. So tomorrow, if they were to get electrified for some reason and get access to electricity, this entire community solar project that has been set up, a microgrid, becomes unviable. So I think we need to bring this aspect of community solar also into the fray. For 90% of or 80, close to 90% of India's territory will fall in high irradiation areas, and solar plus storage is the way we need to go. I don't think we need to get bogged down by the cost per unit and issues like that. I think when you scale up and as you electrify, those costs will kind of, will merge into the larger system. But that's the way forward that I believe. And I don't think we can just look at it as another commercial initiative or enterprise that will pay itself back and completely work outside with the government. These will have to be public-private partnership. There will have to be some sort of incentives, and there will have to be some sort of guarantees for people who have made investments, that tomorrow suddenly you get that whole network becomes electrified. What happens to what's been set up already?
Thank you very much for outlining your points. I fully agree with you that it shouldn't be any other or yet another commercialization of solar, which unfortunately happened in many subsectors. But the message is very clear that we should focus more on the grassroots level rather than on the superficial aspect of just providing electricity, and that will eventually pay good and rich dividends. Now I would like to request another eminent speaker from Power for All, Dr. Payal Parekh, who is the Global Director Health at Power for All, to share her insights from her valuable experience on how the solarization of healthcare centers actually is viable or is important. Over to you. Can you unmute yourself?
Yes. Now you can hear me, yes? Good. Thank you, Prabhu, for the invitation. And I think my remarks follow very nicely after the other speakers. And I just wanted to start out giving a little bit of an introduction of Power for All. It's a very small international organization that has really the mission to make energy poverty history. And we know that there's 1 billion people in the world that don't have access to energy, or they have very intermittent, unreliable access to energy. And we believe that decentralized renewable energy is the way to get people electrified that are off the grid, because it's cost effective, and also it works in remote environments. And unfortunately, last year, because of the pandemic that all of us are living through right now, we started to think about healthcare much more, and realized that there are so many healthcare centers in rural places in India, but in many other countries in the world, that actually don't have access to energy. And Dr. Purnima nicely laid out what issues come up with that it essentially is not possible to provide good health services when you don't have a reliable source of energy, or any energy at all, any electricity. And it means that you essentially can't run life-saving equipment. You can't, there's no storage of vaccines, which right now with the COVID situation is key. And it becomes very impossible to store certain medicines as well as blood. And I just know that many, many years ago in rural Gujarat, I was in a bus with an accident, and my friend actually got injured. And we had this problem because, of course, the Asha didn't have any blood, and they had no electricity, and this was at night. And many lives have been lost in India and other rural areas in the global south because of lack of power. So we thought this is a really good time and an important time to get involved in this kind of work. But we also realized that you have this situation where, on the one hand, the energy sector has said, yeah, we have a solution to meet the need for energy at healthcare centers in rural areas, but they hadn't actually been talking to the healthcare center, and didn't actually understand how or what the needs were. Similar to what you said, Ritu, you can say, oh yeah, we have this solution to bring so much energy, but not actually understanding what is the power for. And through that, we decided that the work that we can do is actually to bring a number of sectors together. And we started this work initially in India. My colleagues, Divya and Anand, were leading on this work and are continuing to work with partners. And now we're slowly getting into sub-Sahara Africa, in Zambia and Burkina Faso, and we're looking to work in a third country in that region. And so what is it that we do? We're not from the health sector like Dr. Purnima is. We are not a solar company like Ritu is representing. So the work that we really try to do is to actually bring together a number of the sectors together, and in this case, the health and energy sector, to actually talk to each other and share their knowledge and the ideas that they have, but also to bring in associations such as the Public Health Foundation of India, where Dr. Purnima is based, trade associations, private sectors, and financiers, but also some technical assistance providers who can look and say, yeah, here's some mapping that we can do for you, which is the case we're working with the WRI office in Africa, to work with the Ministry of Health and Energy in Zambia to do mapping. So when it makes sense, we also try to work closely with the ministries, as Ritu also mentioned in her talk, the importance of it not being outside of the system. And we do that so that these stakeholders can speak to one another and actually come up with very practical solutions to the policy and finance needs, also as a way to mobilize the private sector, as a way to support the government to put together a model solution that actually gets at the systemic problems and isn't just a stopgap solution. And ultimately, we're able to demonstrate market readiness. And perhaps one could argue this takes a little bit longer than simply just, pulling in somebody, pulling in one company and implementing a solution. So while it takes longer, you have a systemic solution that can be then applied across the country. So what are a couple of examples? In India, what we are able to do working through this wide variety of partners was actually to have an open letter that was published last year in Hindi and English and got a lot of press that laid out what the problem is and what possible solutions are, and thereafter forming working groups who focused on specific issues, including technical specifications, policies needed, financing needed, and developed through a national roundtable that happened in August, a national action plan that was released in December, which lays out 10 points around what is needed in these various areas. And ultimately then the next step has been that we've starting to work at the state level, because that is, of course, where implementation happens in India, and specifically in Jharkhand. So again, looking to the areas, the states that have large rural populations, that have needs that need to be fulfilled very quickly, especially given the COVID situation. And so now partners are looking to see if they can support the state government to map the health clinics, as well as assess current access, current energy access levels, and the levels that actually the healthcare centers need in order to work effectively and efficiently. And in the case of Zambia, we are working very, very closely with the ministry. They're very excited, but they know that they need some more support in terms of technical assistance, but also in terms of the in technical assistance, but in terms of also potentially in terms of financing. So we're bringing together a wide variety of groups, and also not just from the energy sector, from the appliance sector, actually bringing groups together that can make recommendations of medical devices that will work using decentralized solar, but also that can meet the needs in a remote environment of a rural healthcare center. Because again, you often have the case where many of these healthcare centers that do get solarized, and they get some sort of medical devices, but they're actually ones that were made to meet specifications of, say, Europe or the United States, and not meant for a remote rural area running on solar. So again, it's that you found a solution, but it doesn't fit the context. And so in conclusion, I think what our work is really trying to do is come up with a model systemic solution and show that it's worked in different countries, so that many countries can adapt such a solution, and not only to combat energy access and improve health services, but as Dr. Purnima spoke about, to keep the air clean, so we don't have public health issues of pollution that we have, for example, in Delhi and other parts of northern India, and also be able to contribute to climate goals. We know that every country has to reduce emissions, and in India, while we have coal, which is actually bad quality coal, we also have a high potential for solar and wind. And it's the only way that we can lead and move forward. So that is where I'm going to stop.
Thank you very much. And in fact, though you mentioned you're not from the health sector or solar sector, thought leadership is often something that actually guides both policy and implementation, and it's very important to have someone to show the direction. A very big kudos to you and your entire team. We at NSEFI, we follow your work a lot. I keep doing the good work, and thank you very much for your insights. Now we have Mr. Dheeraj Kumar Gupta from WRI, again with some insights and some statistics on the status of electrification and solarization of healthcare systems. Dheeraj, up to you.
But I'm not able to share my screen. So I have a very small presentation. If
You can share it now for the present.
now able to see my screen.
Not yet, but we can see that you started sharing it, but we can just see a blank screen. If there's any problem, maybe my office can share their screen with your presentation so that we can go ahead. We are not able to see your screen. Oh, so Ayush, you can start sharing your screen so that we can see the presentation.
Sir, just give me 2 minutes. I'm sharing the screen.
Yes.
So just due to connectivity issue, I'll off my.
Maybe Dheeraj can go ahead without the presentation. Maybe we are facing some difficulties with the presentation.
So I am from the WRI World Resources Institute India, and how we work in the energy sector. I can just brief you out, and how we are looking for the solar energy as a health sector. So WRI is basically a research organization that works in the intersection of the environment, economic, and opportunity and the human well-being. We work on a different energy landscape restoration, sustainable cities, climate, and practices. So coming to the energy program, so we work basically for the energy access for the socio-economic development. And to the next pillar, we work on a build efficiency and promoting the energy efficient devices and urban and to the energy transition in India. So I won't take time as that many of us and Purnima has already inside what are the numbers or the facts and the figures, like 5% of the public health centers are not electrified. And incoming, if I'll talk about the Jharkhand, so that numbers goes around 50%. So I just think how we are looking for the health sector, like where the electricity is a critical role to play. So we see that the, we see actually in a 4 different things, like how data or the evidences, technology, finance, and the policies have a greater role to play to solarize the system, or we can say the electrifying the social loads like health centers and all. So coming to the data and evidences, if we'll see that many of the health centers or public health center, whatever they are, so like some of them are undermet and some are undersized and some are the oversized. So we actually look into what are the indicators or what are the health indicators that to effect from the electricity and how this is going to enhance the health services in India. The technology part. So like Rajiv Gyani sir has already mentioned that the solar system needs to be customized according to the needs. Said what exactly the needs are of hospital. So so we need a different assessment, or we can like Dr. Purnima has already mentioned that health centers or the sub centers are having their load assessment, so we can access them, and we'll talk about that what are the critical loads needs to be just right now I'm going to the next part, like finance. So like Rajiv Gyani sir has already mentioned that when we will talk about the scale, then and then there will be a demand aggregation, then the cost of some of the equipments or some solar system is going to reduce, like in case of the solar pumping system in different countries and in India also. So scaling up of the such solution and getting the finance for such kind of intervention where there is a need of more money. And so in case of the Jharkhand, we'll look many aspects like how we fund or such funds like MPLA fund so that the solarization or the electrification of the center is going to happen. Now I'm coming to the next part of the policy. Like Dr. Purnima has already mentioned that in climate change action plan, where in 2008 there was a mission called National Solar Mission, but in 2015 there was another called National Health Mission. So I'll just highlight one of the issue, like many of the departments and work in the silos, like health department never talked to the electricity department, or the electricity department never talks to the in the health department what their requirement is. And whenever we will meet such of the official or the district administration or the health secretary or something else, so they acknowledge that electricity is a key enabler for them, but the relation between or the coordination is really we can say that poor, so that this is not going to take up in the future. So I'll stop here because I have almost covered everything in there. But there is a very good emerging story in the state of the Jharkhand. Like Payal ma'am has already told that we are working in the state of the Jharkhand, and we are looking more forward to work more on the health and health sector. So POR is really a well-known organization, and we are also working on a similar page. So I use just give me a minute and stop here. If I'll just talk about how we are going to work on that sector. If you see my the IUS screen, then you can see there is a map of the Jharkhand where different indicators like non-electrified primary health center or the primary electrified centers are there. So how this, so you can, this is a internet energy explorer map where you can overlay the health indicators data and see that how these centers are either electrified or non-electrified, and what are the impact if they are having the regular power supply on the health indicators, like MMR is going to reduce, or some or the childbirth or neonatal childbirth are going to improve, something like that. So you can have the greater visualization of the state in terms of the energy explorer map. And this is the dynamic map where everything is gets changed in everywhere, and data is rectified, or we can say updated on a regular basis, so that you will have a better, or you can just select the multi-criteria analysis to select that select the area where the intervention is really needed. So this is the map where we are also working, and this was supposed to launch in March 2020, but due to the pandemic, just we are going more on a deeper level, or we can say the granular level, and we'll come up with the two district map of the two district. We will be launching this Explorer public domain. So thank you, and I'm looking forward to for the more discussion and address any query from the same.
Thank you very much, Dheeraj, for outlining WRI's impactful work. We're very happy that organizations like you are also very active in Indian context and helping not only policymakers with relevant data, but also the stakeholders. You're sensitizing them. With this, we come to an end of the session. Thank you very much for all of your all the panelists for your insightful presentations. We can take one question if any of our audience or attendees have any question. We can take one question at most. If not, we can call it a day. Does anyone have any question to our panelists here? Right. It doesn't look like we have any questions. But once again, thank you very much, Dr. Purnima.
I would like to address one of the things which Ms. Ritu was referring about the mini grid. She said she has information about 100 mini grids in Uttar Pradesh, but let me tell you that about more than 1,000 solar mini grids are operational since last 20 years in Chhattisgarh.
No, I was talking about one company that does about 100 mini grids in UP.
Yes.
Yeah, that is it.
That mini grid is about
Experience of that company in UP is what I'm saying. I'm not addressing the number of mini grids in the country. I know, sir, they are in much bigger than that.
But the important thing is, working since last 20 years.
Yes. I would have thought last 10, 15, I did not know they were working for over 20 years
It
now.
was not only for you, but all the August participants also.
Yeah. No, so that is a learning for me. I did not know we had much of solar before 2005-06. So
I started in 2003.
Yeah.
Thank you, sir, for the. Even I'm surprised that we have microgrids that are 20 years old. It's definitely a very good.
You know what is the reason for that thing? Chhattisgarh CREDA has an operation maintenance exclusive wing, which takes care of more than 20,000 solar systems per month, maybe more than that.
Yes, that's a very good way to handle things. Thank you very much, sir, for pitching in. I would again like to thank Dr. Purnima, Mr. Rajiv Gani, Ms. Ritu, Dr. Payal, and also Mr. Dheeraj for your time. We will make a note of today's proceedings, and we will with both the Ministry of MNRE, which is our ministry which we coordinate with, but also under Deepak Guptaji's guidance, we will also share a note with MOHFW also to seek their inputs and their cooperation on this particular aspect. So thank you very much, all of you, and we're very much looking forward to meeting all of you in person. Thank you. Thank you, everyone.
Thanks for the opportunity.
Thank you, everyone.
Thank you.
Thank you.
Is the meeting over or are we waiting for someone?